This is Healthcare Uprising. We are here to shine a light on the innovators implementing positive change in American healthcare and the patient experience stories, good and bad, that can help others navigate the sometimes overwhelmingly complex American healthcare system. Welcome to the Uprising. We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional.
I always just say, like, keep an open mind. And if, say, ketamine is this option and you don't like it, like, ask yourself why, write down your questions, write down your concerns, and then go straight to the professional and say, hey, these are my questions. These are my concerns. And they're going to end up with what my situation, where it was like a lot of my fears and misunderstanding of it, they went away as soon as I was able to fully understand what it truly was. And if it's still scary, if it still doesn't fit right, then don't do it. It's more, I think we're smart enough, humans are smart enough to understand, our bodies are smart enough to tell us. Like, for me, the ketamine was so out of range, but once I learned more about it, I felt a yes, and that's why I did it. And I think you can trust yourselves, you can trust your ability to make those decisions, but then also be more open and understanding that maybe saying no to it right away is just because you don't fully understand it. So that's my advice. Just fully understand it and go from there. I think too, most people probably take it orally, I would assume. And that's probably what like extends it. Whereas when you do it, through an IV, they can really control it to be like, and it begins and it ends, which is kind of cool, actually.
Gotcha. That's why you go to the clinic.
Yes.
And you don't just buy it on the
I
corner.
think so, exactly. Because
Gotcha.
it was, and like I said, maybe not for everybody. They didn't snap out of it, but they obviously do, because people are walking out of this clinic after, like, your appointment is not that long. They don't want you
Right.
hanging out all day. So
Did you feel like over time, like, so after each session, so you said there's six,
Mhm.
that like every couple days or whatever that time
Mhm.
frame was for you, that you felt better and better and better. And by the way, as like I'm thinking about this, and you'll relate to this as being a
Uh-huh.
mom, it's like you sometimes, like with lasts with your kids, you never know it's going to be a last until you
Right.
realize months or years down the road, oh my
Right.
gosh, that was the last time he or she did that,
Yes.
and it hasn't happened Is it kind of like
Right.
that, where you just start
Yeah.
realizing, like, oh, holy crap, like I actually feel
Absolutely.
so much
And
better?
I guess the only difference is it's like this, like, for me, once that morning I woke up and I just felt better, I just felt better. And so
You
then,
never went back to feeling.
no. And I will say, like, I'm not on any medication anymore. I don't take
I was
any.
going to ask that if
Nope.
you are.
Yeah, I'm
That's
completely off
amazing.
everything.
Wow.
And I do believe ketamine helped me for sure, like, get on that journey. Is it what completely got me there? No, but it was a very helpful tool that pushed me into that next level of, like, unlocking and, figuring out what was going on within myself. And so, yeah. What was really interesting through my experience was the first two, because I signed up to do 6 different treatments. That was kind of what's recommended, is to do kind of 6 in a row every few days to, like, really get the full potential of it being successful. And my first treatment, I remember I was kind of told, like, oh, you'll be able to get some visuals. And I was like, okay. And so I remember my first one, I went in, and the visuals I started seeing, it was like kind of pixelated colors, and all of a sudden maybe I was kind of seeing, like, if you were to stare into outer space. But what was really interesting is I could only see it on half of my vision. So like this side was just black. I couldn't see anything. It was like I could only see the visuals here. And what's interesting too is like when I say visuals, it's like it didn't matter if my eyes were open or closed, like you just still see it. But that's what was weird is for half of my vision, it was just black. And I was like,
Okay.
what?
Can
That's
I
kind of
get it?
bizarre.
It split
Yes.
your brain.
Yeah.
Yeah.
I think, maybe if I had gone to more and talked about what I'd seen, maybe they'd have some follow-up questions that would help kind of unlock, things for me, probably. But I think also going into committing to the treatments and everything, I was a little embarrassed. I won't lie. When I went in, I didn't tell very many people. And once I started seeing the progress of it, then I was like, oh my gosh, this actually works. So then I was like, okay, I'm telling everybody. And I hope I helped people that are more kind of like me, these moms or these people that never did dabble in street drugs or psychedelics or anything, because once I was more open to, yes, this is helping, and yes, I do this, and being honest with myself, I think I was a little more open to the therapy after and stuff like that. But
This has been a Shut Up production.